after a while, people, they're saying, wait a second, it makes sense, right? So Chinese medicine gives you another way to deal with this. And this is what's really important because we're talking about different cultural realities. And culture is what's behind any medical system. Any medical system is a cultural application. Western science is just a cultural application, no more or no less. And that's what my dealing with African culture taught me. I respect Western science within the context that it works and makes sense in. But Western science isn't going to explain what I did with you in terms of your headache. It's not going to explain many other things that practitioners in other cultures can do. It's limited. And folks, unfortunately, have limited themselves. Why? Because largely Africans in the diaspora have lost some of the fundamental elements of their own culture, right? And Africans at home have also, in the process of colonialism and neocolonialism, traditional healers were at the center of society. They had to destroy that. They had to attempt to destroy that, right? So in doing that, you have terms like, witch doctor. If they were talking about that reality here and dealing with Native Americans, they would talk about shamans, right? Two different kind of realities, right? So when I've traveled in Africa, spent time with traditional healers, interviewed folks, and it was funny because I was sent by United Methodist Church, by their head person at the time, Dr. Randolph Nugent, who said, I know there's still healing going on in Africa like in the Old Testament. We want to find out why Africans will still go to their traditional healers and clinics and not frequent our hospitals and use our hospitals as much. That was my mission.
And what did you discover?
I discovered, I'm going to answer that in two ways. I
Yes.
gave you an example. I was in Mozambique at one point. I was staying at a traditional healer's compound, right? And I was still in my interview mode, thinking about, let me just check out what's going on here. And these two people were coming to the compound to get help, and they looked to be of European descent. So I said, oh, wow, let me check out why they're coming here, right? So first of all, when I interviewed them, they identified themselves not of European descent. We're from Mozambique. This is where we are. This is the medicine that we use, right? If we want to find out about what's behind the illness, the relationship between things, what's going on in our life, we go to the traditional healers. If we need a biochemical, some kind of assessment of our blood or something, we'll go down to the hospital and do that. You understand what I'm saying?
Yes.
So different cultural streams, people learn how to use different things. At the time I was traveling, traditional healers were really struggling just to be recognized by their own governments, which a lot of that has changed over the last 10 years because people, traditional healers are realizing, the governments are realizing the value. The World Health Organization is bringing to folks' attention that, your traditional healers are a resource. But, whenever we see Africa, of course, it's still viewed, it's like, the latest thing with Ebola, folks have to go in, give assistance, and the whole bit.
Let me ask you a question about your travels. You took some sojourns from medical school, from your practice, and you traveled China, the Caribbean, Africa, Europe. But I want to ask you about some different specific cultures. When you went to China, or you started learning and you're studying acupuncture and different forms of Chinese medicine, what experience you had there that really stuck with you?
So, okay, two things. Most of my training in Chinese medicine was here in this country. My travels in China were really more to survey what was happening there in terms of Chinese medicine. And I was naive enough too to think that I was going to go over there and set up a business deal where I was going to have the Chinese medicines coming directly to me. So that was an interesting experience. But the two things that have struck me about Chinese medicine, one, you know, Western medicine has taken it upon itself to look at itself as the sum total of medical knowledge to this point.
Yes.
That, they are the arbiters of what is, valuable and what's really relevant to learn, right? So recently, in China, they have their own mathematical formulas now to decide the efficacy of their own medicines. See, because in Western medicine, they're usually looking for the drug, the single chemical ingredient. Mm-hmm. Chinese medicine, they look for formulas, right? So what they're doing is redefining within their own cultural context their standardization. So what they're doing is they're taking the power back. And I'm looking at it, people might say, oh yeah, that's good, Chinese medicine, they're figuring out how to standardize stuff, but they're doing it on their own terms. They're taking their power back. When I was a little kid, people said stuff like, you don't have a Chinaman's chance, right? Ain't nobody saying that now. They are like orchestrating their own reality. When I went back up to Yale to do some teaching, I visited the pharmacology department. There's all Asian folk up in there. And what I see up on the board, Chinese herbs, formulas. They're doing all the research. So not only are they hitting the formula in, it was funny, I was doing some research for a patient on hepatitis C. And I was just looking to see what's up. So it's all through the internet, new Chinese herbal formula, great results with hepatitis C. But you couldn't find anywhere where it's saying what the herb is. You see what I'm saying? So folks are getting hip with respect to their own indigenous treasures. Now, on the other hand, when I was in Ghana, I had a chance to speak to two past presidents of, well, I don't know if the word is president, but the ministers of health, right? And they were not valuing, they had cut down like 50% of the woodland area. They weren't valuing, exactly what the botanical, what that reality meant. It was not being valued. They wanted to clear it to put some other kind of cash crops or whatever, as opposed to developing the your indigenous own cultural profile. That's the thing. You got to develop your own cultural profile, right? You can't copy somebody else's, right? And that's the thing. When I had a chance, because I got into acupuncture early, I had opportunities offered me, like they would have moved me up the ladder in that field. I said, I don't want this, right? I said, it's a useful tool, but ultimately this is not my culture. This is not my reality. It's valuable, and I appreciate it, but there's still other things that have to be done.
And talking about protecting cultural reality and resources, you just set up a Facebook page called Profiles in Global Healing, but I want to read an introduction that you have there. It says, this Facebook page has been set in motion to regain and reclaim the healing that we as human beings are capable of generating and receiving. Sorry, let me cut myself on there so you can say it. Ancestral and divine wisdom flow through all of us, and Mother Earth still seeks to nourish us. We want to explore healing in all its dimensions and hear your stories and what you have witnessed. We want to share our stories for healing so that what seems impossible becomes routinely possible. For what is happening in one part of the world to be possible in another part. We want to raise the bar for what is considered healthcare, and we want you to envision and realize more opportunities for healing in your life. On another day, we will share with you how to publish your stories with us. We only ask that your story be authentic and uplifting. We look forward to reading your stories and commentaries. You are welcome to begin a dialogue around my first story, Kamau Kokai. Right? Tell us about profiles, and what is the motivation?
I would love to. The motivation is, with all the fear around Ebola, with all the limitations that are in healthcare, clearly that both doctors are facing, patients' dissatisfaction with their drugs and medication, right? We have to, and just the reality, like for me, of living here, being born in Brooklyn and seeing certain neighborhoods just totally change, right? So I'm like, wait a second, this really isn't going to be home per se, at least not as it was in that cultural sense. So I am trying to, at this point, the real question is humanity's survival, right? So I've had to look at what's happening environmentally. I've had to look at, in terms of illness, or some people might feel biological warfare, however we want to look at it. I don't want to engage in a fear-based conversation. It's not about that. It's about elevating our vibration to such a point that we can create a planetary network of healing. And part of the planetary network of healing is first raise the awareness. Mm-hmm. When I started doing acupuncture, there was no awareness of what was possible for acupuncture. Nobody had heard it. For years, people asked me, does it work? Does it really work? And now it's like an acupuncturist on every block in certain neighborhoods, right? The concept of healing, one of the stories I didn't put in there, and I realized I'm going to tell this story, and people don't really have the background, either in terms of physics or their own experience, to understand why it would work. But I'm going to say it nevertheless, right? So part of our practice is energy healing. Mm-hmm. And energy healing is used by a lot of other cultures. Energy healing almost gets to what people would start talking about ritual and creating effect at a distance, right? Mm-hmm. So I literally had a condition called atrial fibrillation, where my heart was just beating crazy. This was years ago. And I figured out that I had a thyroid deficiency that was creating it. And I actually used laughter in one case to actually get out of it, because laughter is the energy of the heart in Chinese medicine. And I had a big belly laugh one time, and my heart went back into normal sinus rhythm. And I was fine for about 6 years until a few months ago. A few months ago, it would always happen after I would drink something cold, which was one of the tip-offs for thyroid, because thyroid warms the body, right? But on this particular occasion, it was about 11:30 at night, which is the weakest time of the heart energetically in Chinese medicine. And my chest felt like a jack-in-the-box, with the heart going all over the place. Now, one of the risks with atrial fibrillation is that if the blood settles the wrong way, you can throw a clot and you can end up with a stroke. Because first I said, well, gee, maybe if I just rest, it'll be fine. I said, I might wake up and find I had a stroke. So I am not going to do that, right? I tried my laughter thing. That wasn't working, right? So what did I do? I got on the phone and called a colleague who's very adept in distance healing. It's a brother named Jeffrey Nobles, who's a pranic healer. And we worked together, right? So I said, Jeff, you got to help me out here, right? So I sat down, hung the phone up, right? And I let him work on me, put myself in a state. Now, if you're used to doing this work, you know when you're being worked on. Mm-hmm. So in 15 minutes, I was back in the normal sinus rhythm, right? Called him up. He said, yeah, I felt a change. I said, yeah, I could feel it. Boom. That was done. In the story. Now, for some people, they're incredulous. But this is what I'm talking about when I'm talking about global healing, when I'm talking about planetary connections. Because what we're talking about is mastery of technologies that are transportable across geographies. Now, you might have something going on in a little place that you're living that we may not be able to hook up here in the United States, but who's really satisfied with the therapies for hypertension, with the therapies for diabetes, right? Are we waiting for another drug company to go and exploit some indigenous population somewhere or whatever? So I want to create a global network. This is like part one. Mm-hmm. It's like the awareness. Let's share stories.
Yes.
Let's And when I say share stories, I'm talking about having people that what I call are healing ambassadors. People are in different parts of the world that begin to collect these stories so that we really develop a whole picture. You understand what I'm
Yes, I
saying?
do.
So,
I do.
and one, to inspire people, for people to realize there's more to do than just to take pills. Because what's happened is people have lost a sense of what's possible in terms of their health care, what's possible in terms of feeling good. And it's understandable as our environment has become more um, polluted. You know, our soil is more deficient. Our foods have been altered, so we can't even eat wheat. You know, no one heard of gluten-free food 20, 30 years ago. Now it's like you know, you got to watch it.
Mm-hmm.
I've seen gluten contribute to rheumatoid arthritis, any number of autoimmune disease, gastrointestinal problems. We have so many problems that are related to biochemical toxicity and energetic toxicity around us that I want to create a vehicle to begin to sweep that away. To sweep that away.
I applaud
So,
that. I,
right.
I really do. When I started this program, I was asked several times by different people, why don't you have some sensationalism? Why don't you go after that?
Right.
And I was determined, I still am, to prove or to demonstrate that you can have a media space that focuses on positivity.
Mm.
I I wanted to create a space, and I think I have, where people can be their best selves. I believe that we can share stories that are positive. We can talk about our lives. We can share our stories. I mean, when I say positive, positive with reason, because you might have had a negative experience.
Sure, sure.
And you may have some challenges in life, and you might have fallen down sometimes and gotten up. That's all within the context of what I'm doing, and I'm not going to shift from that, because I think that positivity is important.
Right.
Right. Right.
And you know the thing, um, hmm, the thing for me is that colleagues, right? One of the things when I went to Yale, I realized I'm not going to have many colleagues in this struggle, right? Because a lot of times as black folks, we just happy to be there,
Yes.
right? And we want to learn what, you know, but that wasn't the case for me. I had a great memory at the time. So mastering the information wasn't the issue, but it was like I wanted to maintain and deepen my own roots so that I took the information and I'm trying to do something a little bit different with it, right? So I have this thing on YouTube called Kokayi Academy, just little vignettes where I kind of share like some other ways just to look at things or cases. When I did Global Medicine Review on WBAI for 9 years, programs weren't about me. It was just bringing in people from around the world, right? So Chinese medicine is such a concrete example of its own cultural stream, its own way of looking and defining things. Ayurvedic medicine is coming right there. But the African piece, when I was looking for something to do outside of my office, because I realized for what I'm trying to do, I need a larger venue or something, right? I sat down with folks from the Ford Foundation. I had some old friends there, and I said, well, what what's going to make sense here, right? What could I do? A radio show, whatever. And that's where I got the idea of going back to Africa to look at, well, what is the legacy, right? Because if you just look at mainstream media, is like you see folks just looking all impoverished. You know, even when I was in Africa talking to, you know, bishops that I had to deal with through the church, they were like, we never heard of African medicine, you know. So I'm like, wait a second, our people have a whole legacy that is just filled with accomplishments. I said, what's there, you know? And what's happened is the traditional African medicine piece has been disrupted and attacked on so many different ends that in some ways people had to run to Christianity to protect themselves from all the kind of negative practices and things that were going on.
You think that was deliberate?
Well, yeah. I mean, there are a lot of things that are deliberate, but it's like sitting back and looking at what's been happening. So the idea of this healing, because a lot of the healing that's done in traditional African society, for instance, if you were going to graduate from a real traditional school, you would have to demonstrate your psychic ability. You would have to demonstrate your ability to be in a trance, to hold, ancestral spirits, or to hold different energies and forces. I've seen that, I've experienced that, so I know what that is, right? But it's a matter of we are so far removed in our everyday lives that our notions of Africa, we might think in terms of dance, music, dress, names. We're not thinking in terms of medicine, in terms of science, in terms of healing. We're not taking it there, right? And that's just one cultural stream. I was doing research around this whole topic. In the Philippines, their traditional healers, they've identified 1,390 medicinal plants that they've categorized and that they understand how to use, and that they're protecting their own legacy. That's just in the little Philippine Islands. Do you know how many medicinal plants are around the world? I mean,
Guyana has its own set.
Exactly. And the thing is, what an interesting point, when I was talking to people in Africa, and again, I go back to this conversation, I'm sitting with a group of bishops in Zimbabwe, and they're expressing their interest in traditional African medicine. They're saying, but we're interested in the herbs and what to do, but we're not interested in how all this stuff about how they found out which herb to use. Meaning that the African was not in a laboratory mixing things, dissecting things. That's a Western mind and mentality, dissects things. That comes out of that culture of being in that kind of cold kind of climate. An African environment is just different in terms of how people come to know things. You talk to the plants, right? You have dreams, right? You intuit, you observe in a different way. That he's not going to let you do too much anyway. So things were figured out and determined differently, and folks want to cut themselves off from that. In my office, because of the kind of history I'll take, I'm always amazed to hear how many people come in and they have different kind of psychic abilities or energies that they've had to cut themselves off from fear, because that's what their parents told them, all kind of things, and I'm like, it's really a shame, right? But there's no cultural mechanism really to help develop that. I'm going to talk on and on. I'm going to let you ask me some questions you get me on the topic.
I will take a short break. And
cool.
Because there's you have to come back. You know this, right?
Okay.
All right. Take a quick break.
Does that mean